There has been another blow to education in Oklahoma, and this one might halt or undo the progress that has been made to reduce teen pregnancy. Funding for sex education in Oklahoma has in large part been paid for by the federal government. But in an unexpected move, the U.S. Department of Health and Human Services says the program to help teens stay sexually risk-free will be cut off.
Oklahoma ranks second in the nation among all U.S. states for the highest teen birth rate. That being said, since 2012, the number of teen births in the state has declined significantly. Charla Owens is the executive director of the Tulsa Campaign to Prevent Teen Pregnancy.
We have made incredible progress over the last several years. Since 2012, we have seen a 26% reduction in teen birth rate, and that really is a result of funding like the federal funding that we just received word that we're losing.
Tulsa, Oklahoma City, and the Choctaw Nation of Oklahoma will be losing an annual $8 million federal grant that has, for the last 2 years, paid for evidence-based sex education in public schools.
This was a 5-year grant, and we've completed successfully, very successfully, 2 years of the grant, and we received word that we will receive only 1 more year of funding. So the project will be eliminated after 3 years. It's really disappointing because across the state we were projected to reach about 10,000 of our youth every single year.
Tulsa's share of the federal grant has paid Youth Services of Tulsa to put 8 trained educators in the classroom. Cassidy Collins is the program's coordinator.
We teach in the entire district of Tulsa Public Schools, so every 7th grade and 9th grade student has the opportunity to take one of the sex education curricula, and our goal is to reach 6,000 young people every year.
With a parent's permission, the young people receive very thorough instruction and guidance on everything from puberty, healthy relationships, sexually transmitted diseases, and how to prevent unintended pregnancies.
Every school has a different schedule, so the curricula that we use is 8 modules. It takes us about 8 hours to complete the entire program. So depending on the school schedule, we could be there for a week to even close to a month.
Victoria Hilliard, who just graduated from high school, was on the youth leadership team for the campaign to prevent teen pregnancy.
I would definitely say like 60% of people with like age 15 to 18 are like sexually active, but I'd definitely say that most of them are not being safe about it.
She's worried about the loss of the federal money.
I'm very concerned, definitely, because I mean, the amount of like help that Youth Services is giving to these young people, and not even like just young people, the teachers are learning stuff too, and it's kind of scary because the teen birth rate could go up because they're not learning, they don't understand what's going on, like they don't know how to be safe.
We know that teen birth rates really correlate with poverty, with high school dropout rates, increase in negative health outcomes for both the mothers and for the infants too. And it's just a huge loss for our workforce, and it's an impact to our economy immediately, and that just rolls forward. It has a domino effect that often carries forward for multiple generations.
Laura Bellis is with the Take Control Initiative, which provides teens and women with education and free clinical services for implant birth control and IUD birth control devices. She and others are worried the loss of federal grant money to prevent teen pregnancy may just be the beginning of what may come. And that could be the unmantling of critical family planning programs funded through the Title X program administered by the United States Office of Population Affairs. The office is now headed by Teresa Manning, an anti-abortion activist who has been critical of family planning programs.
14% of Oklahomans are uninsured. They fall in an insurance gap where they maybe make a little too much to qualify for Medicaid, too little for private insurance, and so Title X's funding a lot of healthy preconception practices, STD and STI testing. It's where a lot of people get contraception and family planning services, and if Title X goes, they're not going to be able to get those resources affordably somewhere else.
The Trump administration's 2018 budget proposal calls for an 18% reduction in discretionary money for the Department of Health and Human Services, which funds the Title X programs and community health centers.